Hello again. This is a quick neuroradiology case. The case is intended for students, interns, and specifically junior radiology residents because a few of you guys asked for similar cases. This is an 81-year-old male patient who presents with recurrent falls and syncopal attacks. One of the major differences between brains in the young population versus those of elderly patients is that the brain loses volume as age progresses. So with that, you notice that you have less brain parenchyma with more pronunciation of the CSF spaces, being the ventricles, sulci, or the CSF surrounding the brain peripherally. Now imagine this is one of your first on-call cases as a radiology resident. You're looking at this alone, and you've seen lots of elderly brains with volume loss. This is what you're thinking about here. However, there are a few things that you have to notice. The first thing is that if volume loss is leading to this degree of pronunciation of the CSF spaces, you would expect a proportional appearance to be seen within the ventricular size, which is not that large, in addition to widening of the sulci. However, the opposite is happening here. The sulci are not that widened, they're actually probably effaced or compressed. If you look even more carefully, you'll notice other findings within the CSF spaces peripherally as well. Although the density of the peripheral CSF space, the subdural space, appears to be dark, almost equal to CSF, it's not exactly as low density as CSF. Look how this looks a bit different, very dark compared to this area. So that's another hint here. Finally, something that might be difficult to see, but it's a useful sign. Look at this structure here. These are superficial cortical vessels. The vessels should be seen within the CSF space outside here and there. However, if you look at any of these vessels, you'll notice that they are displaced towards the brain. So there is something displacing them closer to the brain itself. So if you put everything together, you'll figure out that you have bilateral subdural collections. The density of these collections is very dark, denoting chronicity, and that's consistent with chronic subdural hematoma. This reminds us that blood acutely appears bright on a CT brain, but as it ages, more than 3 or 4 weeks, it becomes chronic and becomes dark in density, in some cases almost equal to the density of the normal CSF. So the diagnosis here is bilateral sizable chronic subdural hematomas. So let's summarize the teaching points here. The first thing is volume loss is commonly encountered in older patients. However, make sure that that's the case and that you don't have compressive abnormalities from outside that mimics that phenomena. The second teaching point is you could have unilateral or bilateral subdural hematomas, which could be acute and bright or chronic and very dark, simulating CSF. If you have a bilateral chronic subdural hematoma that is symmetric, that could be easily missed. Finally, one of the things that you could look for is actually displacement of the vessels inwards to help you decide if you have a collection, whether it's hematoma or not, in the subdural space. That's of course easily seen if you give contrast, but you could see it without contrast as well, such as what we see in this case. That's it for today's case. If you found this useful, please spread the word about the account. If you have any comments, please send them my way. Thanks for watching, and see you with more cases later.